I am Dr. Saumitra Ray, Director of Intervention Cardiology at Advanced Medical Research Institute, Kolkata, and ex-professor at Vivekananda Institute of Medical Science. Today, I will give you some key take-home message about ambulatory blood pressure monitoring. As we know that blood pressure varies with various factors in our day-to-day life, and it is important to know all those variations to have a clear assessment of blood pressure status and the outcome of blood pressure. Ambulatory blood pressure monitoring is a good device, a good tool to assess all those variations like the dipping pattern, the morning surge, the white coat versus masked hypertension, blood pressure variability, and so on. We know that white coat hypertension means when blood pressure is high at office and low at home, and the reverse is masked hypertension. It is very important to detect it because masked hypertension need to be treated with pharmacotherapy, while white coat hypertension is usually not needing a pharmacotherapy. Also, we need to know the morning surge, which causes loads of stroke and heart attack. So, we need to appropriately control the nocturnal blood pressure by lifestyle management and appropriate medication, their dosing and timing. Ambulatory blood pressure needs a cost and infrastructure, patients' motivation, and doctors' awareness. In a country like India, it is proving to be a little costly and cumbersome. So, our aim is to reduce the cost of ambulatory blood pressure monitoring and make it more available so that you can use more extensively by general physician, by cardiologist, and all types of doctors across the board. Ambulatory blood pressure not only helps, as I mentioned, in detecting the various types of hypertension, but sometimes it also gives an insight about how the treatment is going on, whether the patient is compliant and taking the medicines in appropriate doses, because sometimes people say that they are taking medicine, but the pressure is not controlled, and then you know by ambulatory blood pressure monitoring then the patient may not be compliant. So, these are a few things which sometimes we compare with home blood pressure monitoring, when of course, when the patient is awake, he takes his blood pressure himself. It is not an automatic process when you need the patient's motivation. But in ambulatory blood pressure, it is taken both day and night every half an hour. So, usually there is 40 to 50 readings in a day, and that should be clearly averaged out. And there is very clear-cut guidelines nowadays, both Indian, American, and European guidelines to know the exact values of ambulatory blood pressure, the daytime average, the nighttime average, and the 24 hours average, when to call it normal and when to call it abnormal. But the basic barrier is to be aware about the existence of ambulatory blood pressure monitoring, its importance and relevance in blood pressure management, and to use it pragmatically for the best benefit of our patients.